Morning, my name is Dr. Sabrina.
Good morning, my name's Giselle, and this is my son Sam.
Hi Sam, how old is Sam?
Sam is 4, and
Nice
we've just
to
been
meet you,
having
Sam.
this problem recently with his skin. He's just been having these rashes, mainly around his face, and more recently his arms and legs.
Okay. When did you start noticing these rashes?
When he was about 3 years old, he started having them mainly just on his face and
Okay.
his arms.
Did
but
it
then
change over time, the distribution?
It did, yeah. It moved towards, his inner arms and the backs of his legs. So, of course, we took him to the GP, and we've just been told to use these emollient and steroid creams for him.
Okay. And when you're saying this rash has been moving, you feel that it's getting worse or?
Definitely, yeah. It seems like it's getting a bit more severe in terms of how itchy it is. And we've also noticed more recently that it's been having this yellow sort of crusting on his mouth and his eyes, and that's just been concerning us.
So he's been looking quite sick with this.
Yes.
And you feel that it's been coming and going. Does it go away when the GP gives you the medication?
It does, for a temporary fix, once we stop using it, it comes back,
Okay.
and it's just been getting a bit worse recently.
How is that impacting Sam?
It's very stressful.
Is he in school?
He is, but we've been taking him out more recently just because he can't handle being in the school environment, and it's just been very stressful for myself and his father. He's sleeping in our bed, but then he's not actually sleeping at night. He's crying all the time.
And why is he sleeping in your bed?
Just because he's so irritated and anxious about it. It's stressing him out, and he doesn't really know how to handle it. He starts scratching himself.
Okay. Anybody in the family with asthma, hay fever, eczema?
His father has asthma, and last winter we brought Sam into Tala Hospital. He was admitted for just having some wheezing. They told us it was just a viral kind of asthma.
So that's the only past admission to the hospital with this viral asthma. Okay. Anything else that could exacerbate this rash?
Not quite sure. His father's a smoker. I'm not sure how much that might
sometimes
impact
smoking can affect these kind of rash. Do you know, has the GP ever told you what kind of rash this is? Or explain a little bit about it?
We heard that it might be eczema or maybe psoriasis, but it's never really been clear to us.
Okay. For his age, the inflammation on the skin, and you feeling that when he goes to school, he gets worse. Any carpets in the house?
Yes, so it's all carpeted.
Okay. Sometimes, this is called eczema because, you have this inflammation of the skin, but it's sometimes caused because they have been in contact with things like pollen, dust mites, or even smoking can exacerbate that. What we can do is the main treatment would be to use the steroid and the emollient. This is the other mainstay for treatment for eczema. And when you're explaining about Sam right now, I can see that yes, he is probably in the severe presentation, moderate to severe presentation, because of the itchiness, the coming and going of the rash, the implication of the arms, especially in the antecubital fossa, which means the flexor areas, behind the knees, and on the face, around the mouth. The fact that you're having oozing and crusting, maybe it's superimposed infection on top of it.
Right.
And then also the fact that he was admitted with something like a wheeze. It's kind of put him in the category that is a little bit worse. It's a bit severe. Usually eczema means that you have this inflammation because there is a break in the barrier of the skin.
So do you think that might be from the scratching?
The scratching can cause the break more and increase the risk of infection getting into it. But sometimes soap or the kind of cream, and sometimes as babies when they are exposed to food initially at a very young age, you might find that it's irritating to the skin, and then it causes damage to the skin lining. And it could be also genetic, environmental factors that cause this complication, it could be a lifelong thing, but we can put it under control, and hopefully if he knows how to manage it going forward, maybe we can reduce the impact. Like I said before, steroid and emollients are the most important medication to use initially, and then if it progresses to get worse, then we can put in stronger medications. But what you have to do maybe is to try and reduce the risks, like maybe not smoking in the house, and maybe the cleaning of the carpets to avoid these dust mites and things like that, and fibers that can irritate his skin. And I will prescribe you a little bit of antibiotic because you're saying there's crusting, so we can try and treat the infection.
Okay.
And then I'll give you a little bit of emollient and the steroid cream, but I will give you the ointment because maybe it's easier to apply to the skin, and it's a little bit easier than the cream.
Okay.
So you'll have to apply on the whole body.
Okay.
I'll give you for a week of twice a day that you bathe him for about 10 minutes in a lukewarm. Don't use these soaps, but maybe like moisturizing soap or moisturizing gel or emollient type washing soap. And then you pat him dry and apply the emollient on top of the skin first, all over the skin.
Okay.
And then apply the ointment for about a week, and then we'll do a reducing dose. Maybe instead of twice a day for the next week, we'll use it once a day, and then alternative days. And I'll see you maybe in about 4 weeks.
Okay.
I will see Sam and see how this is going.
Great.
And do you have any questions?
No, I'm all good. Thank you. Very helpful. Bye.